Okay, I'm Valerie Lavender. I'm a nurse practitioner student at Auburn University. My course of study is pharmacotherapeutics 7246. My class of drugs that we will be discussing tonight is non-steroidal anti-inflammatory drugs, also known as NSAIDs. There are 4 over-the-counter medications, which is aspirin, ibuprofen, naproxen, and ketoprofen. There are 20 prescription drugs, which is Selectin, Orudis, Meclamin, Voltaren, Motrin, Daypro, Feldine, Nelfan, Ansis, Clinaril, Diloved, Relafin, Celebrex, Mobic, Lodine, Toradol, Indocin, Trilosate, Butazolidine, and Anaprox. NSAIDs are produce an anti-inflammatory, anti-analgesic, produce an anti-inflammatory, antipyretic analgesic effect by inhibiting the production of prostaglandin synthesis. They work together by blocking the chemicals that causes inflammation. They are absorbed in the GI system. They peak 1 to 2 hours, and they are bound to protein. Their volume of distribution is low. They're metabolized in the liver and excreted by the kidneys. There's no lifestyle changes needed when using NSAIDs, but we need to use cautions in prescribing NSAIDs to the elderly, to patients with GI disorder, ulcers, renal insufficiency, hypertension, and cardiac problems. We should not prescribe NSAIDs to people who have a hypersensitivity to the drug, who has angioedema. NSAIDs also come with a black box warning for perioperative pain related to CABG surgery, also for pregnant women, because these medications can cross the blood-brain barrier, and they should not be used with chronic alcoholism. The drug interaction is anticoagulants, which may increase the possibility of internal bleeding, antihypertensives, which may reduce the diuretic effect. Also aspirin, which may negate the antiplatelet effects with low-dose aspirin use. The side effects is GI disorder, renal insufficiency, hemolytic effect, pancreatitis, and it also has fluid retention. These drugs are selected according to the source of pain, the severity of pain, and the side effects of these medications. Long-term use is only, when we have long-term use, we need to monitor these medications because of renal insufficiency. When educating our patients, we should educate our patients to take the medication as prescribed, to take it with a full glass of water or with meals. If you find out that you have missed a dose, take it as soon as possible, within 1 to 2 hours prior to the next dose. If you're taking this medication for fever, you take it only for 3 days. If you're taking it for pain, you take it only for 10 days, unless otherwise instructed by your healthcare provider. I have 5 takeaway points related to these medications. NSAIDs may cause heart failure. They may cause renal damage. They also may cause GI damage, which is internal bleeding and ulcers. They have a serious allergic reactions. They are harmful to children and teens, especially if they are taking aspirin during the flu or chickenpox, which may cause Reye syndrome. I thank you. This has completed my discussion on NSAIDs.